One of the leading causes of death around the world is choking. And there's nothing more terrifying to a parent than encountering a choking child and not having any idea what to do or how to help them. So I'm here today to show you how to perform the Heimlich maneuver on an infant and a child. So one of the important things to be able to do, first of all, is recognize that your child is in fact choking. Now for an infant, signs of choking would be that they have a red face and that they're not making any noise. If your infant is crying, then they are not choking because that shows that they are able to move air in and out to make that crying sound. So, to identify that your infant is choking, they are not going to be crying and they are going to have a red face. And depending on how long they've been choking, they may even be taking on a bluish or purplish hue. So that's when you need to step in and act fast. So when you first recognize that your infant is choking, you want to scoop them up and you want to find a seated position. So to properly perform the Heimlich maneuver on an infant, you're going to brace their head and neck with your hand and let them rest on your forearm. Now you want to be careful with this. You don't want to let the baby's face just lie in the palm of your hand because that's going to suffocate them and that's going to defeat the whole purpose of doing the Heimlich maneuver, right? So brace the baby's head and neck in a way like this and let them rest on your forearm. You're going to lay your baby on your thigh with its head lower than the rest of its body, okay? And then with the heel of your hand, you're going to deliver 5 forceful back blows right between the shoulder area, okay? You don't want to pat your baby on the back. You don't want to sit here and just pat your baby because that's not going to increase any pressure. And the purpose of the Heimlich is to increase the pressure in the thoracic cavity to force that object out, whatever's blocking that airway. So to do it effectively using the heel of your hand and with the head lower than the rest of its body, you're going to deliver 5 forceful back blows, okay, like that. After you deliver 5 forceful back blows, brace the back of the baby's head and then roll the baby over like that, still bracing the baby. Then like you were going to be doing CPR on the infant, you're going to use 2 fingers and perform 5 chest thrusts. 1, 2, 3, 4, 5. And again, you want to make sure that the baby's head is lower than the rest of the body. Every time you roll the baby, you want to make sure to keep that head lower than the rest of the body. And you're going to repeat those cycles, the 5 back slaps and the 5 chest thrusts until that object is eventually expelled. Okay? So that's how you do the Heimlich maneuver on an infant. Now, the child Heimlich maneuver is a little different. It's a lot different. To do the Heimlich maneuver on a child is going to be the same as you were going to be doing it on an adult. Like I said with the infant, one of the first things you want to be able to do is even recognize that your child is in fact choking. So if your child is choking, you may notice that their face is turning red. They're not making any sound. If somebody is looking at you and they're saying, help me, I think I'm choking, help me, then they're not choking. Because talking is a sign of air moving in and out, something that you're not going to be able to do if you're in fact choking. So your child's face is going to be turning red. They're not going to be making any sound. And this little number right here, somebody grasping their throat, is the universal sign that's used worldwide to signal that somebody is choking. So if somebody's doing this, their face is turning red, and they're not able to produce any sound, they are in fact choking. And again, you need to step in there and take action. So, excuse my child's purple hair. We went a little crazy today. So to do the Heimlich maneuver on a child, you recognize that your child is choking. Depending on how tall your child is, you may need to kneel down behind your child and to get on their level. So you're going to pull that child in close to you. You're going to find their belly button area. Using the pinky side of your fist, you're going to put that right there at about the belly button area, okay? And then you're going to roll your fist upwards. Now, my child here is a little smaller than a normal toddler would be, but that little trick right there, it will help you find correct hand placement, because you don't want to be up too high on the breastbone, because if you're doing the Heimlich maneuver on the breastbone, you can actually break the tip of that breastbone off and cause a lot of unnecessary pain. And believe me, you don't want to do that to your child. You want to help them. So, get in behind your child with your child right up close to your body. Find their belly button, put your fist there, roll it up. You're going to be in about the right position. If it feels hard when you start to press in, you're going to want to move that hand down till it's nice and soft, okay? Using your other hand, you're going to grasp that fist, and you're going to pull inwards and upwards at about a 45-degree angle in hard thrusting motions, okay? Like that. And you're going to keep doing that until that object is expelled. Now, this is one of those cases where if your child starts to vomit, hallelujah, that's a great thing. You want your child to start vomiting if they are choking, because that lets you know that that airway is now clear. So, now that I've showed you how to perform the Heimlich maneuver on an infant and a child, I hope that everybody is a little more prepared to step in and act in an emergency choking situation. Thank you.